Thank you for the introduction. Ladies and gentlemen, good morning. I am Dr. Wui-Chiang Lee from the Taipei Venture General Hospital. It's my great privilege to be here and to be in Hanoi, such a beautiful city. Okay, because I have limited time, I need to run fast. This is the brief of my introduction. I got the clinical doctor, gastroenterologist by training, and I got my master and PhD degree at Johns Hopkins of the United States about 20 years ago. And because I am focused on the hospital management and also the quality of management, so that's the reason I am here. And this is the outline today. Before the introduction, may I do a quick survey? How many of you in this room has been to Taiwan? Please raise your hand. Okay, thank you. And how many of you are from the hospital or healthcare side of Vietnam? Okay, almost zero, except my count. Okay, thank you. About maybe about 1/5. Okay, so I will give you a brief introduction of the Taiwan's healthcare system. There are about 23 million people in Taiwan and about 480 hospitals and 18,000 primary care clinics in Taiwan. On average, there are about 31 doctors per 10,000 Taiwanese. So this density is quite, I think on average, still lower than the OECD country. All these hospitals and primary care systems are highly managed by the government. And so the patient can freely select hospitals as their destination. In Taiwan, we also have the universal health coverage. We call it national health insurance since 1995. So all the Taiwanese and the legal resident can enjoy the universal coverage by the single payer system, not by the government. And every month we need to pay the premium. And almost 93% of our hospitals are contracted with the National Health Insurance Agency. So we can go to any hospital or any primary care clinic for medical services. Recently, the Taiwan government has initiated we call the core strategies based on our strong infrastructure in the ICT. And so there are but precision health is one of them. So together with the precision health and ICT industry to be our next generation industry, that's the government policy. On the other side, hospitals also face a huge challenge. First, hospitals compete with each other because we compete not by the cost, because by the government. So the patient we compete by the quality. And second, the reimburse for fee for service, which means hospitals need to work harder because high productivity means high revenue. And third, the payment rate is so low, so the cost constraint is still very important. So by efficient and timely services and medical manpower shortage, especially doctors and nurses, that's a very important issue. So we need to adopt automation in our daily practice. And the high medical liability issue, so we need to build a safer environment for our medical personnel. I would like to talk about the smart hospital. By definition, smart hospital can be defined as medical institutions that create new value and insights on patient safety, quality of care, cost effectiveness, and the patient centeredness using the information, communication, and technology. That's the your expert. And provide it in a qualitative manner to patient and medical staff. So the introduction of smart hospital, not only for our patient, but also for our medical staff to make them more efficient. This is the hospital I work in, the Taipei Venture General Hospital. We are building in 1959. This is the largest public hospital in Taiwan and also the major training medical center. We own about 3,000 beds. In one campus. Where is the slide? Okay, thank you. And we own more than 6,000 employees. And every year we operate more than 52 operations. And also we have a huge publications as an academic or medical center. And to facilitate, to mobilize the effort and investment across different departments. So hospital developed a steering committee for the smart hospitals. And we focus on 7 domains. I call them ABCD, EFG. ACE means artificial intelligence, the blockchain, and the cloud system, data management, edge computing, the fifth generation, and the gene bank. So this is 7 domain is actual technical domain. However, because we are the hospital, so we need to work for our patient. And also, so all these domains should be dedicated to our patient, the flow and the process of care. From the outpatient, every year we need to serve 2.5 million outpatient a year, and more than 100,000 emergency patients. For inpatient, the surgical treatment, pharmacy, and the management. So that's the framework of my presentation today. This is our outpatient. I want to mention how do we do a smart outpatient services. So because we already had a long queue before, and all the patients need to wait in front of desk. But that has become the history, because all the patients can make an appointment and scheduling and even pay the bill using their mobile phones. But there are many applications you can use that. The patient can also get their information from the mobile phone, even though for the vaccination record and many other things, the lab record. And the patient, when they see a doctor, they don't need to have a long queue outside, the so-called queue management. So either in front of the clinical room, they can see the number, the sequence of their visit, or they can go to a cafeteria to just see their mobile phone, because all the sequences are on the mobile phone. And then push a message to the patient that, oh, you will be next to patient, please come back from the cafeteria. So it's very convenient for our patient. After introduction of this smart system, so you can see our waiting time decreased from 45% to 70% at the rush hours. And almost 80% of our patients don't need to pay the cash. They can pay by the digital or e-payment. And almost 70% of our patients can discharge from our ward directly and using the e-payment. And actually, if I am here, I can use the mobile phone to pay for my father or my mother when he or she was discharged very remote. It's very convenient. Not all of us are working very close to our families. In Taiwan, we have the universal health coverage, so every patient will hold a smart card. The personal information, medical treatment, and the well-being of the donation, organ donation are all saved on the chip card. And the doctor has we call the doctor card for the electronic signature and for the data approval. And now we are moving to the virtual card. So we are providing a random QR code for each time of visit. And recently, the government built a cloud system that's called the medical system. Now you can save all the information for 23 million people in Taiwan. By law, all the medical information, including the surgical record, lab data, imaging, all the services should be uploaded to the public cloud. Actually, it's a secure public cloud, not a public cloud. And so all the doctors can see the information across different hospitals and the clinic. And patients can download their information to their mobile phone to see their recent data or examination result. They can show to their private doctors. You can see not only the chest X-ray, ultrasound, CT, MR, and endoscopy should be uploaded. You can see this is quite a large database, an imaging database. So we can do a lot of analysis and AI reviewing in the background. And almost all the hospitals in Taiwan and the primary care have the electronic medical record for about 20 years. And the most important is electronic record linked to the medical cloud. So I can find the patient who receive how many different medicines in the other hospitals to avoid duplication. So can this see the analysis. After introduction of the linkage of the hospital EMR and the medical cloud, many duplication was decreased significantly, especially for the chronic disease like diabetes, hypertension. You can see they can increase the safety and efficiency for the patient. And we also have adopted many AI-assisted outpatient clinic. And we can not only for the arrhythmia, brain tumor detection, and many other diseases. And you can tell our professor who is also be with us this morning. And so AI is not only a technique, it has been used for our clinical care. We also use the AI, this is what we call the colonoscope, because I am a gastroenterologist. We do the colonoscope every day. And the AI can help doctors to track and to help us to diagnosis. For example, this is the benign polyp. You give me a number, you can see. The AI tell you it's about 100% benign instead of a malignant cancer. That's the AI assisted colonoscope. I will mention about the smart inpatient service because we need to handle about 3,000 patients a day in such a huge flow. So the Taipei Venture Johnson has invested the nursing management system since 1992, almost 30 years. That means you can see the history, the evolution of our management system. From the EMR, now we to have a very advanced nursing system. For example, the barcode system. For all the patients will get a unique barcode on the wristband. So the nurses will check the barcode before blood drawing and the administration of medications for safety reasons. So after introduction of the barcode system, there's no more misidentification for our patient. And about 1/3 of our patients are cancer patients with cancer for the chemotherapy or the other radiotherapy. And all the information, we link the information of the pumping system and the patient information to a nurse's mobile phone. So nurses can take care of their own patient, will not be distracted by the information, go back and forth from different patients. And for those who live in a single bedroom, we have adopted the bedside monitoring system. We can integrate all the information such as medical information, the treatment plan, and nursing call, and even they can use it for the food calls on the first floor. And our pharmacy system has integrated from doctors' ordering system, the dispensing system, and the nurses' the administration system. All are linked by a single system. And our pharmacy has been regarded to be the best, the good pharmacy practice training center in Asia. You can see every day we need to handle about 3,000 test tubes for our blood drawing. That's always a long queue for us. You can see it here. After drawing the blood, there is a trail. They are just very close to our technicians. And this is the robot. The robot, the arm, can pick up the tube and to different destination. It can increase efficiency actually of our service. Telemedicine has been a growing issue after the pandemic. So during the pandemic, we have widely adopted the telemedicine within the hospital and across different hospitals. With the help of the Zhonghua Tel company and the Advantech and many other our partner companies, we expand our service to many nursing homes and many rural areas using the telemedicine, not only for the interviewing but also for some specialty service like oncology, ophthalmology, and dermatology. This system also being widely used for the quarantine at home or the hospitalized patient. You know, some patients after infection after got the COVID-19, they got the hypoxia at home, and that's very dangerous. So we use this system by the Zhonghua company, the 5th generation, so we can get our information for those at home. And this system has also been extended to for the patient after discharge for babies. Babies, when they're at home, the mother or father, they can monitor the vital signs and the oxygenation at home for our babies. And also we have this new smart operation room. Every day, now we expand our operation room from 50 to 68, the largest number in Taiwan. We integrated many patient information into one platform using the Microsoft HoloLens system and their software. So doctors can integrate patient information using their HoloLens before operation and explain to the patient and their families. We also adopt the MR, the mixed reality, in our practice for operation. You can see before operation using the 3D CT and the MR and for the recording and to pre-operation planning. So that can increase the precision of our surgery and increase the safety before our surgery. Also can improve our communication between the patient and our doctors. Okay, this the AR and the VR has also been used in our training for the junior doctors, junior nurses. it's not good for them to practice before enough training. So we use the simulation training programs and the AR and the VR for the training. We also use the AR VR to explain the procedure to patients and their families for safety reasons. And we also build the simulation center. We also introduced the first robotics mentor, that's from the Lexing company, and for the training for the robotic surgery in Taiwan. And actually, we will have the first heavy ion surgery center in Taiwan by May this year. This is a very important tool for the cancer treatment by radiation therapy. So this will be the first one. Actually, you can see this picture. It happened just last month. The director of Mayo Clinic, the #1 hospital in the United States, he visited the hospital to sign a cooperation MOU with us because there hasn't been any heavy ion center in the United States. And I think now and in the future, the data integration and the analysis has been more and more important for the management and decision making, especially for the management as the leaders. So we have adopted the command center. This is a concept from the Johns Hopkins when I was there. And I said, oh, yeah, we need a command center. But now we have moving forward to another platform. We're using the mobile phone. So when I was here, I can use a cell phone. There's an app. I can see the occupancy rate, the revenue every day, and the visit number by the mobile phone. So we can have a mobile EIS, Executive Information System, by the Microsoft Power BI and the other softwares. That's a very important platform because hospital management will like the air traffic control tower in the future. And our effort should be promoted by the government and many NGOs. So every year, Taiwan will host a national campaign for smart hospitals. It has been for about 7 years. There are two major awards. One is called the National Healthcare Quality Award by the Joint Commission of Taiwan. Another is by the Institute of Biotechnology and the Medicine Industry, we call the SNQ. So this is the picture. The Taipei Venture Adjustment, we just earned the Golden Award for the Smart Hospital last year. And we also host many expos for the Smart Hospital every year, almost once or twice a year. So this year we will host the Smart Hospital Health Expo. I think there were more than 300 hospitals and our IT industry will join this expo in Taipei. We also welcome all of you can come to Taipei for visiting because this is a picture from last year. And there are many delegations from Vietnam to visit Taipei for this expo. Not only for our industry, but also for our clinical doctors and nurses. Actually, for the past few years, more than 45 doctors, nurses, and pharmacists have come to Taipei Viettel Hospital for our training since the year 2019. And you can see this is the main hospital just in the Hanoi city. And actually, because of the pandemic, so we are continuing to our training by the teleeducation system. I think I would like to make a conclusion here and share our lesson. First, I think the smart hospital should be policy-oriented and by a national basis, not just by one hospital or two hospitals. Actually, many hospitals should do the same thing. Nuclear is also an important issue for our IT industries. And also, the second very important is hospitals' awareness and the commitment to the digital transformation. I have talked to many different hospital leaders in different countries. Many of them realize the importance of the digital transformation, but still the others don't have such a concept. So I wish to let all of us know this is the importance of that. And all the ICT I think should be dedicated, also adapted to the patient flow. That's very important because if we cannot improve the quality of safer care, hospitals and doctors will not realize the value of the system. So it will not be continued. Because the investment to the smart hospital is a huge cost for hospitals. And sometimes you cannot get the revenue from the investment very soon. So we need to continue to persuade them to do that. And we will recommend you to also have a steering committee for the policy and the investment, also important the manpower. And finally, I think that we need to continue to do the performance and the cost evaluation, and very important to work together with all of you. Hospital need to work together with the ICT industries. We cannot work alone. And on the other side, ICT expert like you cannot work alone because you don't need maybe you don't realize the real need from hospital side. I think the real need from hospital may be different between Taiwan and Vietnam. So, but anyway, I also welcome you to Taiwan again and to visit Taipei Regional Hospital. I will share with you more about our smart hospital. Thank you.